So thank you. It's a privilege to have an opportunity to tell you a little bit about a programme that my colleague Fay and I have been developing and indeed are still delivering for a local authority in the Midlands. It's a local authority very much seeking to build on child and family training over the years, particularly around assessment and analysis, and starting to plan interventions. And it's certainly a local authority that is seeking to think about the whole process of work, from assessment to analysis, decision-making, planning, and of course now thinking about interventions. And Fiona and I were reflecting earlier on a meeting probably about 3.5 years ago when we were reviewing the SAFE child protection decision-making materials as part of a group. And at the end of the session, Arnon took the last 3/4 of an hour or so to introduce what was starting to be materials relating to this new Department for Education funded project, developing intervention resources. And I'm not sure if you've ever been in this situation, but I found myself almost slightly embarrassed because I wanted to break into a round of applause, partly because Stephen mentioned reference to the last stage. So assess and analyse, and we can do that over and over again, but I guess at some stage thinking about how do we promote change? How do we help children and young people with the trauma or the legacy of their past experiences and how they're playing out now? And that seems to be a really important squaring or completing of the circle. So the programme that we were developing very much for this local authority was very much around looking at these whole processes, really. We were given the task of meeting 19 learning outcomes for the first 2 days on assessment, analysis and planning interventions, and a further 6 learning outcomes for a day on permanency that the social workers within the group were going to talk about. Fay will say a little bit more in a minute about the range of practitioners. But over the years I've come to never underestimate the power of a well cross-referenced matrix. And one of the tasks in preparing for this course was to take those 19 plus 6 learning outcomes, another 7 or 8 local practice themes that they were keen to incorporate, and to look at how they could link in with the materials and how the content and process of what we were planning would reference across. And then, for good measure, and I suppose it was partly to demonstrate the effectiveness, to link things through to the expectations of working together, 2015, the knowledge and skills statements for social workers, and the HCPC standards. And actually that was quite an interesting process, not least in terms of, I suppose, feeling confident about the relevance of the materials.
As Phil said, this was training that was sort of in 2 parts, so assessment, analysis and permanence planning. And what we did was we worked with a whole range of people, so a little bit different than Fiona and Carla were talking about, because we did have some ASYEs, but we had all these people here. And this authority particularly wanted to try and bring together the early help prevention side of their service and some targeted family support with the wider social care. And they wanted to try and increase the dialogue between those 2 parts of the service to help them understand each other's roles, but also to try and have some shared approach, tools, evidence-based practice that could be sort of replicated as children and families moved through the service, so that practitioners weren't starting again with a different approach as they moved from early help. So we had people right from early help through to adoption, really. Some interesting teams. There were some people from the hospital, just a couple of practitioners who came and were very involved and enthusiastic, and they worked with vulnerable people who came into A&E, either for drugs or other substance misuse, or for self-harming, suicide attempts. So we had a whole range of people. The unqualified workers and the social workers together did 2 days of the assessment, analysis and planning interventions, and they had 2 coaching days, which Phil did following that. And then just the qualified social workers came back for permanency planning training and then had a following coaching day. And I think they really valued working together as a large group. We did 8 cohorts, I think.
Yes, indeed. Yep.
So sort of about 20 on each. So quite a large number of people through the service.
Okay, thank you. Just a quick example of some of the resources that we drew on to inform this programme. Some obviously in use in everyday practice, from genograms to eco-maps to chronologies, and thinking about the value of those in helping us to understand past and present experiences and realities for children and families. But then we drew on other materials, and for me it highlighted the value of a modular approach, being able to select resources appropriately to link in with the needs of a particular authority or indeed the needs of particular practitioners. So linking with the assessment framework, validating that through its reference to in working together, and the social work evidence template and the expectations of how practitioners might think about their analysis and understanding of the links and the patterns that can help us understand children and young people's lives. The development of strengths and difficulties diagrams, which you'll find in the resources, again taking some and adding extra layers really to our understanding of a child or young person's health and development, the care that they're receiving, and the various factors that may influence that positively or not so positively. Some of you may have seen in the resources that have been used around assessment and analysis, evidence-based indicators around protection and resilience and risk and harm factors. We put together a little course workbook using case material. We incorporated reference to the questionnaires and scales, as Fiona and Carla were talking about, and then elements from some of the other child and family training materials, systemic analysis from the child protection decision making. And all of that was supported by a variety of materials, including an introduction to some of the intervention guides.
Just a little bit about feedback, really. We're always interested as trainers to hear feedback, and this authority were particularly interested to hear about how practitioners evaluated the training, but also to go a bit beyond that and think about what impact it had on their practice and what beneficial outcomes there were for the children and families they were working with. So we tried to evaluate according to all those learning outcomes, and people were rating how they felt at the beginning of the training, how they felt after the training, and then carried on with the coaching sessions that Phil did with them, and how they were feeling having used the approaches and knowledge and skills with families. So that was just some feedback, and I think people really welcome having tools. There was a whole range of people, as I said, from unqualified ASYEs who liked having things at the start of their practice, through to people who were very experienced, but still found new things, still found ways to reflect, and were particularly welcoming of the intervention resources and what that brought, feeling, as I think Arnon and colleagues did, that had perhaps come away from social work practice over the years, and they felt, it was really beneficial to have a chance to think about intervening again with children and families, and then have some tools and approaches to use.
Okay, so there's just a few references to some of the feedback around the training itself at the top of the slide there. In the second half of the programme, so the later cohorts, the local authority wanted to particularly think about the impact and some of the applications of the material and the resources. So we developed and linked it in with the coaching and reflective practice sessions, a way of recording what people were using and why and how, the context in which they were using it, saying a little bit about what they did, and particularly then thinking about the impact and the perception of the service users, the children, the young people, the families, in using the various tools and resources. And I chose this last quotation. This came from one of the reflective practice coaching sessions just last week. And it was a practitioner working in a group care setting. And she had taken one of the elements of the intervention guide around working to modify abusive and neglectful parenting. And I thought, this sounds useful for a young person that I'm working with. So around stress and those cycles of situations, feelings, thoughts, behaviours and consequences. Adapted that for use with this particular young woman in the group care setting, and it led to a range of activities involving the staff, pulling the staff into role play exercises, and then some of the other young people in the home. So rumours of a spontaneous outbreak of engagement in role-playing somewhere over the central England are not to be taken lightly. And in fact, I guess we might want to reframe that as a practice simulation exercise. But I think what it really showed was an enthusiastic and perhaps newly confident practitioner working with an enthusiastic and confident young person to think about change. And that seems a very good example, actually, of beginning to see some of the ways that this material is being used and informing practice. Thank you very much.